Hi, Dr. Paul. Another question I get with my social media sites, Instagram and TikTok, and then please subscribe on YouTube, is how do antidepressants affect my sleep and my energy? Good question. It depends on the antidepressant, depends on the person. Because the right antidepressant should improve sleep, not worsen it. Because the right antidepressant should also really help anxiety. And what typically leads to problems with sleep is anxiety. Anxiety causes people to not sleep that well. They sleep surface sleep, a lot of up and down sleeping. So how do antidepressants affect it? Like I said, the right antidepressant can really help the sleep because when it lowers anxiety, your sleep improves. The right antidepressant can help energy, and sometimes SNRIs, sometimes Wellbutrin can help. So it depends on the person. It depends on the symptoms. All of this is symptom-based, by the way. What I do is all based on history. It's all based on taking a complete review of symptoms, asking about their sleep, their energy, their this, their that. Every tiny little thing I want to know for me to make a right decision about what to give the person. And when I give the right, and the other thing is that if I give the wrong thing, I know and I take it away. If it's the right thing, sleep improves, anxiety goes down. And if it's the wrong thing, by the way, where it doesn't work or makes them feel worse, that tells me a lot. It tells me like I have to go back and reassess my diagnosis and say, okay, maybe I need to approach this differently. So, if sleep is a major issue, maybe I need to put in a mood stabilizer, like a Seroquel or something like that. Now, again, Seroquel would be if someone has really difficult sleep, really difficult insomnia. Seroquel is amazing. Can it be too sedating for some people? Yes, it's not for everybody, but it's great when it works. It's great. But if someone, let's say I add an antidepressant and it really helps their mood, their anxiety, but the sleep is not better or it gets worse. It's combining. It's okay, let's keep the benefit of that, but let's add something here to maybe let's tune down dopamine so the person can actually sleep. So that's why combining medications is often the trick of it all. And it depends with the first choice I make, what are the benefits? Is there any negatives? Now, if there's any negatives that are significant, I stop it. If there's any negatives that aren't super bad, but we want to get rid of it, I have to think about, okay, what's going on chemically? What do I do next to stop that? So it's all about figuring out how to balance things, and that's all done with a little bit of trial and error. It's not just throwing darts at a dartboard with trial and error. It means making rational decisions based on the information I have. And when I do that, when I get it correct, everything is balanced correctly, and that's the goal with treatment, is the proper balance when there's no residual problem with sleep. And sleep is very important, by the way. Insomnia is miserable to have. It's no fun laying around in bed just staring at the ceiling and just not shutting down. It's not a fun thing to have. So but I address all that with my patients. I want to make sure your sleep's good, your energy's good, everything is clicking properly.